This is the ABC 7 Morning News.
Plus, fighting migraines with a brow lift. Meet the Bay Area doctor helping patients get rid of their pain with a cosmetic procedure. There are advances to report on an alternative treatment for migraines that we first told you about when it was in its earliest stages. ABC 7 News health and science reporter Carolyn Johnson tells us this procedure involves plastic surgery.
The procedure was actually discovered by plastic surgeons after several patients told them their migraine headaches disappeared after surgery. Now that procedure, originally known as a brow lift, has been refined. Geraldine Allen loves quilting and babysitting her 6-year-old grandson, but at times she's been in far too much pain to do either because of severe migraine headaches.
Oh, it feels like nausea, light sensitivity, noise sensitivity, throbbing, pounding pain.
Good to see you again.
Thank you. Good to see you.
But after decades of pain, Geraldine says she finally found temporary relief, and now she wants to make it permanent.
Dr. Miranda injected Botox in both of my temporal nerves, and it put a stop to the migraines.
Dr. Edward Miranda isn't a neurologist, but a plastic surgeon in San Francisco. He says the success of the Botox injections confirmed that Geraldine's migraines were potentially treatable with a procedure that originally evolved from cosmetic surgery called a brow lift.
We're basically decompressing the nerves that are pinched in certain patients with migraine headaches.
Yeah, that looks a lot better.
In an operating room at California Pacific Medical Center, Dr. Miranda carefully severs small sections of muscle to release pressure around the nerves that he believes are triggering Marianne's headaches, the same area that was being relaxed by the Botox.
On the right, you see the zygomaticotemporal branch of the trigeminal nerve, and that's the second most common nerve that causes migraine headaches.
We first reported on the technique 2 years ago. Several neurologists we spoke with at the time were skeptical about the long-term benefits, but Dr. Miranda points to 5-year data recently released by researchers at Case Medical Center in Cleveland who pioneered the surgery.
And those data show that these patients have, 88% of the patients who had improvement have persistent improvement.
He says several minimally invasive surgical techniques have also been developed since the original brow lift approach. Geraldine is hoping the operation will free her permanently from chronic pain.
It's going to mean that I don't have to be at home after dark, that I can be out and I can drive without worrying about headlights triggering a migraine. It's going to mean that I can have more quality time with my grandson.
Since the surgery is now for the direct treatment of migraine and not cosmetic purposes, Dr. Miranda says it is most often covered by insurance. I'm Carolyn Johnson, ABC 7 News.